Welcome to this week's episode of Making the Shift from RN to NP. I'm Katie Vogelart, Nurse Practitioner. In this limited podcast series, we'll explore what it's really like to make the transition from RN to NP. At Hippo Education, we work on real-world, practice-changing guidance to help you become the best NP you can be. For being a listener, we'd love to share with you our free NP clinical resource guide, which you can download at hippoed.com/makingtheshift. Now let's get started. One of the questions I get asked frequently as a nurse practitioner educator from my students is about whether it's a good idea to go to some sort of post-grad education, a residency, a fellowship after NP school. Personally, I started out my NP career in an emergency department internship, and I thought the extra support and education helped me tremendously as I made that transition from RN to NP. I'm excited today to talk to my friend and family nurse practitioner, Anna Hughes. She just completed a year-long primary care fellowship, and I'm excited to hear all about her experience going into that fellowship straight out of NP school. Anna, welcome to Making the Shift.
Hey, Katie. Thanks for having me. Glad to be here.
So tell me more about this fellowship that you went through. What was it like?
Yeah, so I went through a primary care fellowship program. It was hosted at a federally qualified health center in Colorado Springs, Colorado. And it was about 13 months long. They make it 13 months so that when the new fellows come in at about 12 months, there's some overlap for continuity of care with patients. And they do a really good job. You start off slow, kind of seeing a few patients at a time with the faculty members and getting feedback there, which I thought was super helpful. And then throughout the program, you also get some specialty rotations with women's health providers, pediatricians, and then even a few specialty rotations with rheumatology and endocrinology. So just lots of things that, you get some of in nurse practitioner school and maybe throughout your clinical experience, but it just kind of adds to the foundation of your practice a little bit. And then throughout, as the program progresses, you slowly start to grow more and more independent, and then by the end of it, you're seeing your whole panel of patients and seeing them all independently as well.
So your fellowship sounds like a really good mix of didactic, getting to build on things that you had already learned in NP school, maybe learning some new things, and direct patient care. But I know, because I know where you went to school, that you went to 3 years of NP school. That's a lot of time and over 1,000 direct patient hours. So why did you decide, after putting in all that time, to go to a fellowship to continue, in essence, kind of continue your education after NP school?
Yeah, it's a good point. It was, I think I would say for anyone who's considering a fellowship, that is definitely worth considering, because a fellowship is it's not just any other first job. There is continued work with it. We also had to do like a quality improvement project. So coming off of the program that I did and then being asked to do another one of those was not the most exciting things right out of school. However, I when I got towards the end of the program that I did, I just started kind of looking into residency programs. I think in school, you can have the best clinical experiences, best preceptors. You could even be working at the clinic where you'd like to be a provider at. And I think there's still going to be a learning curve there. There's still going to be some gaps. The scope of practice from nurse to nurse practitioner, there's just a very large learning curve there. And so I thought that a residency would just be a great opportunity to, again, like I said, continue to build that foundation for my practice and begin my practice off on the best foot that I possibly could start off on.
So it's not like you didn't get what you needed in school. I'm trying to bust that myth. It's not like you didn't learn anything in school and so you had to go to a fellowship, but you really felt like you needed that more supported and structured um, transition to help you to become transition into that role as an NP. I'm assuming there was a period of time between when you graduated and when you started your residency. What did you do during that time to help make that transition from school to residency easier?
Yeah, and I would just say, yes, you do get what you need in school. You get a good foundation, and the learning curve will be there regardless of whether you do a residency program or not. But you have a good foundation coming out of nurse practitioner school, so I'll help you bust that myth as well. um, but I honestly think the best thing that I did in between fellowship or in between graduation and the fellowship program was just to rest. Um, Especially if you, which I guess maybe we're getting out of the time period of people being in grad school during COVID, but if you kind of graduated around the time that I did, you were most likely a nurse in the hospital during COVID. You were also in school during COVID trying to find clinical sites, and you were exhausted. But regardless of whether or not you went through that or you just did grad school in general, and most nurse practitioners are working through their program as well, and so you come out pretty exhausted. And I think the best thing that anyone can do is just take some time off. You don't want to go into your new job or program or fellowship or whatever you end up doing burnout. So that would probably be the main thing that I would say was the most beneficial.
I think that's really wise. Just to take some time and recognize the hard work that you put in, the blood, sweat, tears, hours, energy, lots of money, and just take some time to rest and prevent burnout in your NP career, I think is really wise. So you said earlier that you really valued that support and wanting to make that transition a little bit more gradually, your role transition from RN to NP a little bit more gradually. And that's why you decided to go into your fellowship program. Did it happen? Did you feel like you got that support you needed? And did it make that transition easier for you?
Yeah, I think it really did give me the preparation that I'd hoped it would. I think we even got to see that the cool part about being in a fellowship program is that you're not the only new nurse practitioner in your practice. You're with a few others who are also in the same boat as you are. And so I remember we would get to like 3 months in and then 6 months in, and then we'd look back and we'd be like, 6 months in, you're seeing almost a full load, and you look back and you're like, wow, I used to think 4 patients was hard. And now you're seeing like 12 to 18. And so you really get to see kind of the progression within the program as well. And then you also, I think, at least my program, we the faculty, you would not be presenting patients to the faculty for the entirety of the program. And so you would slowly start to realize, oh wow, I didn't need, my faculty today, or which nothing wrong with, we have questions. You should continue to have questions every day, but you would just kind of slowly grow in that independence. The one thing I will say is that since the program, I have moved kind of to a different specialty area. So I went from primary care to urgent care, and as expected, there's a learning curve with that as well. But I think the foundation that the residency sets, especially if you do one for primary care or for urgent care, or I would assume for like emergency medicine as well, you can, with the ones that have more kind of a broader base to them, I think you're well prepared for whatever role you decide to take next.
I'm really glad that your fellowship really did set you up for success. It sounds like even in transitioning, not just from RN to NP, but from one NP role to another, which is great. And I love the idea of reflecting back. And so I'm going to let you reflect back. If you could go back to Anna 6 months before you graduated, so like your last semester before you graduated NP school, and you could talk to that Anna and give her advice before starting your residency, what would it be?
Oof. That's a hard one. I think one, I would just say you're where you're supposed to be. um, I think we all, have kind of like this imposter syndrome. We don't feel like we know enough. And there's kind of a both and truth to that, is what I like to say, is you don't know a lot. We come out of this knowing a little about a lot, but we also know more than we think we do. And especially if you have nursing experience, you also know more than you think you do. You have the kind of medical clinical instincts, I would say, to how to care for patients. Do you know how to care for the newborn on their 72-hour visit yet? Probably not, but you will learn that. And so I think that's what I would say is you're where you're supposed to be, and you don't try and come out of the program feeling like the best, most expert provider, because you won't be, but you're where you're supposed to be, and you can come out of nurse practitioner school being a good provider.
That's good advice for yourself. I think that imposter syndrome is pretty universal. I'll go out on a limb, and I don't have good data to support that, but I think it's pretty universal to NPs coming out of school. And likely, whether you go straight into your first job or you go into a fellowship, you're struggling with that feeling of, am I enough? How do these people let me get a diploma and see patients? Like, do I actually know what I'm doing? You mentioned that you faced that even in residency. Tell me how that showed up, and what did you do to help battle that during your residency or fellowship?
Yeah, I mean, in the beginning, you kind of, at least I'll speak for myself, but I do think this was a pretty universal experience among my cohort, is you go in and you're seeing patients, and yes, you do know, again, you know what you're doing, but it also feels like you're the patient's listening to me. Like, I'm giving you this recommendation. Am I sure about this type thing? And the answer is yes, you are. You do know. And I think so. I would just kind of go back to what I said is I think having a healthy understanding of knowing where you are. I think as nurses, if you've been a nurse before you go into being a provider, you probably ended your nursing career feeling pretty much like an expert, right? Like in your area or on your floor or your unit or whatever the case may be. And now we're entering into this new part of our career where we actually start back at kind of like that advanced beginner stage. And so I think it's important for us to kind of acknowledge that truth, I would say, maybe in the imposter syndrome, but also with the confidence knowing that you do have experience, that you do know, a lot. And also that, if you, which hopefully, you care, you're doing your best to care for that patient in front of you, you're going to try and find the answer. There's been plenty of times when, especially in this first couple of years, where I've told patients, hey, I don't have the best answer for you right now, or even, I need to look into this further. Can I call you? That type of thing. And I think patients just really appreciate knowing that they're cared for. And that also kind of just helps battle that, I would say there's a little bit of truth in every lie, right? There is that truth that you may not have that answer, but you're going to do your best to find it.
There's a lot of humility in that answer, Anna, and honesty with yourself of, yeah, you're right. I don't know everything. And sometimes that's okay. I know how to be safe. I know how to care. I know where to go and what resources I need to sort of help me. I think that was just really great insight that you gave on imposter syndrome. Anna, thank you so much for just taking the time to share about your transition from RN to NP, specifically going through a fellowship program. As we wrap up, will you share just a couple of pieces of advice for any NP who's listening who is going through that transition from RN to NP, specifically in a fellowship program?
Yeah, I would say I don't know if I have just one piece of advice, but I'll leave y'all with a few things. So first, I would say don't forget why you started. And I think sometimes when you first start as an NP, that can be kind of a challenging moment to, if your why was maybe you were looking for an easier role than bedside nursing, and it's not that. And so if that is that is okay. That's okay. There's grace for that, but find that bigger why, and just constantly remind yourself of that. Secondly, I would say just have grace for yourself. Like I said, you're where you're supposed to be. You do know what you need to know to get started, but there's still a long way to go. So just have grace and patience for yourself. And then finally, with that, I would say just keep going. Like with any area of medicine, it is a lifelong learning career. You're going to keep growing. You're going to keep learning new things about how you want to practice, and so just keep going. Again, it's tough getting started, but don't be discouraged.
That's great advice, Anna. I wish I could have that recording just play for me before I go into a clinical shift. That would help me a lot. Well, thank you so much for taking the time to talk with us today.
Thanks for having me.
Thanks for listening to this episode of Making the Shift from RN to NP. Be sure to head to hippoed.com/makingtheshift to get your free NP clinical resource guide. Visit hippoed.com/NP to explore even more education from Hippo to make your transition from RN to NP as smooth as possible.